Welcome to St. Joseph's Hospital, the best place to have a baby in Syracuse. When you are in labor, you come to the front of the hospital, park in the front where we offer valet parking till 9 o'clock at night. After that, just leave your vehicle there and enter the hospital, and later we'll make arrangements for you to move your vehicle. Before arriving to the hospital, you would have called your doctor or midwife, and they would advise you when the best time to come to the hospital. And then they will also notify labor and delivery of your arrival. When you do come to the hospital, as you walk in the front door, you will be greeted by your security. Let them know that you are in labor. If labor is imminent, they will offer you a wheelchair and take you right up to labor and delivery. If you are up to it, then you are able to walk to the maternity unit. You will take the elevator up to the 5th floor. Here you will hit the up button. Enter the elevator and hit 5. All of our maternity services for both moms and the babies are directly on the 5th floor. When you exit the elevator, you will look right at the sign. It will say birthplace, labor and delivery. You will turn right, follow the hallway to where you see the clock. There, you will turn left. And again, follow the signs to labor and delivery. You will walk past our intensive care nursery, which is conveniently located between maternity and labor and delivery. Up ahead is the family waiting room for any of your family, friends, visitors to wait while you are in labor. When you arrive in front of the labor and delivery, there is an intercom. Hit this intercom and tell them your name. The receptionist will then open the door to allow you in. All our maternity units are secure, so only people who have purpose to come in here are allowed in. You will follow the hallway in, and you will see a sign for the receptionist. At there, she will greet you to sign you in. And she will let your doctor or midwife know that you have arrived. Hi, this is Triage. This will be the area that you're first going to be evaluated when you come into the hospital. This has 9 beds. This is where your doctor, your nurse, or a resident might do the first evaluation. If there's any kind of medical concern, this is where you will be evaluated. This is also the area where you will be to recover after cesarean section. Let's go over and check one of the beds. Hi, this is the triage area. This is one of the beds here. It's a nice quiet area where you're going to be evaluated by your nurse. She's going to hook you up to an external fetal monitor where we're going to measure the baby's heartbeat and how far apart your contractions are. If you're more comfortable in a rocking chair, it is here, and you will be here for approximately 2 hours where we're going to decide we're going to keep you here in the hospital and admit you to labor and delivery or go home. This is our typical labor room. We call these LDR rooms. You labor, deliver, and recover right in here. This is a typical labor bed that we can use to position you into just about any position that's going to be comfortable for you. The bed could also break down where the feet come down. When moms are ready for delivery, we also have footrests. We don't use stirrups, so moms can place her feet here to make it comfortable. We also have squatting bars that can be placed on this bed if mom would prefer to use a squatting bar. In labor, some of our comfort techniques that we use exercise balls or birth balls to help you with movements, to sit on, for using in different positions to help you during your labor. We have rocking chairs available in every room. There is a chair here for the partners that is very comfortable, that also pulls out to a cot. So if mom is sleeping, there's an opportunity for her partner to catch some extra sleep also. Each room has its own bathroom with its own shower, and so there's close by for moms if she needs it. After delivery, we have a setup here in case of babies need any extra care at delivery, oxygen suction, and a warmer. Typically at delivery, babies are going to be placed on mom's belly and on her chest, skin to skin, with warm blankets placed there and staying there for an hour. If the baby is compromised in any ways, that's when it will come here, be evaluated and checked out, and if everything's fine, goes right back into mom's arms.
Hi, my name is Marianne Dwyer, and I'm an RN in labor delivery, and this is sort of my area of expertise. This is our C-section room. It's also called a surgical delivery room. We have 2 of them, and they're here for your use in the event that the natural birth doesn't happen all the way to the end. We're here for you if you need a C-section. So we wanted to just try and give you a little familiarity of the room so that you could kind of have a little bit easier time if you're coming into labor. So I'm going to show you a couple areas. The first spot is where we do our anesthesia and the table that you'll be laying on. This is our anesthesia area. This is where your head will be. Anesthesia will work back here. There's lots of machines. Some of them they need to use. It's routine for most people that they will use some of the machines, but they won't use all of them. But they're there for if we need to have them. Your coach will be allowed in after we have you all draped and ready to go. And she or he will sit over here next to you in this rocking chair. And when the baby comes out, we usually try to have the coach stand up and kind of watch the birth if they're comfortable with that and you're comfortable. And then they can be part of the birth when the baby's coming out and you can see the baby being delivered. Once the baby's born, the doctors will give the baby to one of the nurses, and then we'll bring the baby over to your head so you can give the baby a little kiss. And see the baby for a minute. And then we'll bring the baby over to a bassinet and dry the baby off. And I'm going to show you that right now. Here's the bassinet. It's a warmer, okay, because the room you'll find is very chilly. But underneath here, the baby has a radiant heater. And this is where we can check the baby out, make sure the baby's getting pink, getting dried off. We do all the baby care over here. And your coach can come on over as soon as the baby's stable. Come over here, help us with the baby care. They can cut the cord over here. They can help us put the diaper on. We weigh the baby over here. And the baby's weight will be up on the screen here, which your coach can take a picture of if they'd like to for the baby book. And once the baby's all done with baby care, we have your coach usually sit back in his or her chair, and we will wrap the baby up and bring the baby over so that he or she can hold the baby, and you can see the baby again. And he can show you the pictures if he's taken any pictures. And then once the surgery is all done and we move you back into your own bed, you and the baby will go down to the recovery room with your coach, and you get to hold the baby all the way down. So we try to keep everybody together through the whole process so that you don't get separated. As long as the baby's stable and you're doing okay, we try to keep the family together. And you go down to recovery room together, and then you'll stay down there to recover for a couple of hours.